Okay, so my name's Dr. Patrick Ezie. I'm the medical director for Silver Cross Hospital, working with Parkway in helping sex workers in Nigeria, the capital FCT, Abuja. And it's been a really interesting partnership. We have gotten about 10 women currently in our care who are pregnant come through the hospital, and there are a few interesting findings that we have been noticing since we started the project. First of all is that we have noticed that generally these women are pregnant and have a lot of them haven't had any antenatal care throughout the 9 months of their pregnancy. And some, this is the first time they are visiting hospitals. And coming to Silver Cross, they are able to now understand that there's a lot that they should have been checking in the last 9 months. So what does this mean? It means they've been going 9 months without prenatal vitamins, without adequate counseling, with poor nutrition, and of course, with the sexual exposure, they are more at risk of more illnesses, STIs, and HIV. So what does this all mean? It means that it translates into a system in which we are now having women with the highest risk possible at the time of pregnancy. A case in point is Mrs. Veronica, one of our patients who presented at 9 months. She had a previous CS a few months back and is currently pregnant and retrovirally positive, and intended to deliver the second baby at home, if not for the intervention of this project. So what that means is a woman with all these risk factors, short pregnancy interval, she's never been for antenatal in this current pregnancy, had a CS in the last pregnancy, and has other risk factors, presented to the hospital almost at 9 months and had initially planned to deliver that baby at home. So for everybody who understands what it means that she was at the highest risk of uterine rupture possible, and not just uterine rupture in a facility, uterine rupture at home. So if she had attempted that, she probably would have bled to death at home, and it would just be coined as another maternal mortality statistics. So there is a lot that I have seen in the very short interval. Yesterday we had a woman come in and she was a known hypertensive, 9 months pregnant also. This is her second visit. She hasn't had a pre-antenatal exposure, and just her vital signs. The first blood pressure we took was 180 over 120, very high. And then she says she stopped feeling fetal heartbeats. So we had to take her quickly into the labor ward and check the baby. And once we did that, we found out that the baby's heart rate was fluctuating and even went as low as 80 beats per minute. And that required an emergency cesarean section, which we had to do so quickly to bring out the baby and resuscitate that child. So it would have been impossible for her to have had that kind of experience at home, because all that would have happened is she would have given birth to a baby, an IUFD. Baby will come out dead. So there is a lot that the project has in its early phases has started to unearth about these women, about the problems that plague them, about the need for them to have that specialized follow-up and care, because they are more at risk of all the maternal complications than the regular women in the society. Because with the regular women, you have the urge from the spouses, from the family, to go to the hospital for care, and but with this group of women, there is that they are basically feeding from hand to mouth. So healthcare is a luxury, and because it's a luxury, they now bear the brunt, because there's a complication. When the complications come, they accept it because they feel nobody offered and I'm too busy providing for myself and whatever children are available. There is also one other thing that is worthy of note, which is that a lot of them are multiparous. So they have had multiple pregnancies with children at home, and sometimes for the age that I'm seeing in the current geographical space of Nigeria, where they are having more children than their current age bracket. So, for instance, a woman of 26 and it's her sixth pregnancy, and you're wondering how, okay, but because of her like her job, you can understand why she will have multiple pregnancies. Some may have resulted in abortions and all that. Also, there is another finding of having multiple partners, so the children already have multiple fathers, and that alone psychologically can be unnerving for a regular woman, a regular African woman. But these women are able to bear all that with some courage and still push along and push through their current problems. Of course, the issues of sexually transmitted illnesses and HIV is, of course, very known to all of us. And yes, we are seeing a little rise in this population than we see in our current in the regular population in the communities, But the good thing is that we are also noticing that a lot of them are already on HIV medication, which means that the HIV program is also effective and helping. But that notwithstanding, it also presents another factor, a risk factor for the unborn children and also for their care, because a lot of them with assessing their viral load at such interval can be problematic. And we also are trying to achieve a next generation that is free of HIV and AIDS. So because of that, we need this kind of projects to be supported, to be sustained, and also to give us the outcomes that we all want to see in the lives of these women. Because it is worthy of note that if these women die in the process of childbirth, they leave behind children, and those children become orphans of the society, and the tendency for them to continue this cascade of being children of the society, where they choose to armed robbery or sex trafficking or become victims of self-trafficking or sex workers themselves, continues. So the future will be better if they are able to be supported to have these children, they are alive to train them and help those children to live better lives, go to better schools, and so that the next generation doesn't have to be a sex worker to train his or her children. So she needs to be alive more than any other, at this phase of her life, at the reproductive phase of her life. Judging her profession judging what she does to raise her children is not the answer in this case. The answer is she needs this support. And of course, as I said, most of them already have many children before and are still in this business. So supporting them to have safe deliveries and supporting them to live healthy lifestyles while choosing this profession is equally important, because the longer she lives, the better the lives of the children, the better the society, because those orphans might end up being negative elements in the society, which is what we don't want. So Silver Cross will do its best to see that the women have the best outcome possible, and we'll also do our best to ensure that whatever it is that we notice, if it's preterm labor, a lot of them, yes, also are having preterm contractions. And although they may not be truthful with the reason why the preterm contractions are starting, but again,